student at the University of Memphis for a nurse practitioner, and I'm going to be doing your head-to-toe assessment today, okay?
Okay.
This assessment is going to go through your systems one at a time, and I will have to visually inspect, actually touch, and sometimes listen, okay? Do you have any questions?
No.
Okay. I'm going to start with your face, and what I'm going to do is just look at your skin, and I'm looking for any swelling, bruising, abnormalities, scarring, and that is all good. I'm going to touch now. It's nice and warm to the touch. And any tenderness or anything like that?
No.
Okay. All right. And so I'm going to test cranial nerves 5 and 7 with this. And what you're going to do is, if you'll close your eyes for me, you're going to feel sensation. It's either going to be hard or it's going to be soft, okay? And just let me know if you feel it and when you feel it, if it's hard or soft, okay?
Okay.
Ready?
Mm-hmm.
Soft, hard, 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 soft, okay? And then I'm going to get you to go ahead and clamp your jaw. Good. I'm just feeling that master muscle and relax. Any pain with that?
Mm-mm.
Okay. All right. And then I'm just going to go ahead and while I'm on your face, any tenderness on your sinuses?
Mm-mm.
Okay. All right. And I'm going to go ahead and inspect your head and inspect your hair. It's equally distributed. It's nice and thick. And I'm just going to feel on your skull for any abnormalities, any tenderness, any of that. She is normocephalic. Go ahead and straight up for me. Good. I'm just going to feel your temporal arteries here. Any painfulness here?
No.
Okay. And then preauricular, postauricular, occipital, submandibular, submantle, or anterior, and posterior, and then subclavicular lymph nodes. Any pain there? There was no swelling or any abnormalities that I found, okay?
Okay.
Now, if you could just puff out your cheeks. Good, make a kissy face. And smile big and frown and be excited. Perfect. All right. Now, I'm going to move on to your eyes, okay? Your eyes are symmetrical. Your eyebrows are evenly, and your eyelashes are evenly dispersed. They're growing well. There's no missing hair or anything. They're symmetrical. I'm just going to look at your palpebral fissures and your conjunctiva, nice and pink. Your sclera is white, and your pupils and iris are within normal limits. Now, doing this, I'm going to check cranial nerve 3.
Mm-hmm.
So I'm going to get you to frown and then open up big against. Oh, good.
Mm-hmm.
Perfect. And then cranial nerve 2. We're going to test your vision. If you'll hold that for me, cover your right eye. Okay. Read the top line from right to left.
LMNOZEAB.
Okay. And then cover your right, or the other one. Thank you. And then do it again.
LMNOZEAB.
And then both together, read it backwards for me.
BAEZONML.
Good. All right. And then cranial nerves 3, 4, and 6 is going to test your extraocular movement as well as your peripheral vision, okay?
Mm-hmm.
So what I'm going to do, and then light reflex as well. So I'm going to take this light source here. If you'll look at my nose, normally we would turn the lights down to get the best, but just for purposes. And again, good. Pupils are equal and reactive on both sides. Now, I'm going to get you to follow my finger with your eyes and not your head, okay? Good. Perfect. And in and out. Great. Now, if you'll focus on the tip of my finger here,
Mm-hmm.
and then look out to the wall, and then back to my finger, and out to the wall. Good. All right. You see my little bunnies? All right. I'm going to start at the top, and every time they come into your line of vision, let me know, okay?
Now.
Good.
Now.
Perfect. All right. So now I'm going to move on to your nose, okay? And I'm just going to look at your nose, and it is nice and symmetrical. There's no obvious deformities. Is it tender to touch anywhere? Any of that? Okay. You can also test olfactory, cranial nerve 1, which will test smell if we had some scents right now, okay? Right now, I'll get you to occlude one side and sniff. Good. And the other side? Good. And just make sure they're nice and patent. I'm going to check your nasal turbinates now. I'm just going to look in there. Nice and pink. No signs of trauma. No bleeding. Any pain in there? No rhinorrhea. Now, we could also look in the eyes and check for red reflex, which I need to do that real quick. Look straight ahead for me. And I'm just going to look for that red reflex. And structures. Good. And then one more time on this side. And everything is good in there. Now, we'll go ahead and move on to the mouth. Can you smile for me? Good. Nice symmetrical smile. Lips are pink and moist. They're not dry. All right. Now, I'm going to go ahead and look at your throat and do an exam there. And we're going to test cranial nerves 9, 10, and 12, okay?
Okay.
And doing that, it's going to be gag reflex, swallowing, and range of motion of your tongue, okay? So I'm just going to use this to kind of look. Go ahead and let me see your teeth. Good. And I don't see any abnormalities or trauma there. Open up big and wide, and I'm just going to turn your tongue over to the side. Buccal membranes in the side of the tongue and this side. Good. Nice and pink. And lift your tongue up. Good. And the floor of the mouth. And tongue out for me. And then we're going to gag. Good. Gag reflex. And the palate is intact and within normal limits. Swallow for me. Good. Any pain with that?
No.
Perfect. Now, your tonsils are gone. You had those taken out, right? Good.
Yeah.
So any pain in lesions or anything that you've noticed in your mouth, no bleeding or abnormalities, great. So I'm going to move on to your ears, okay? I'm just going to touch here and look. There's no bruising, no swelling. They're nice and intact. No bruising behind the ears. Any pain with those when I pull?
No.
Any drainage or anything recently?
No.
Okay. And go ahead and just look in here. Good, positive. Light reflex and structures are visible. The TM is intact and clear. Any pain with that?
No.
And then same findings on this side. Any pain on that side?
No.
Alright. Now I'm going to do some hearing exam, okay? So what I'm going to do is I'm going to tap this tuning fork and I'm going to place it on your skull.
Okay.
Just let me know if you can hear it, okay?
Okay. Yes.
Can you hear it on both sides equally?
Yes.
Good. And that just checks lateralization of sound.
Okay.
And then I'm going to place it on your bone. Just let me know when you stop hearing it. This is testing bone conductivity in air.
Now.
Okay? And then this one.
I can hear it.
Let me know when you've done it.
Now.
Okay?
Yeah, I can hear it.
Okay?
I don't hear it anymore. I hear it now.
Okay.
And I don't hear it.
And then I'm just going to do a whisper test. So what I want you to do is cover this ear for me. I'm going to whisper something and just let me know if you can hear it, okay? Yes.
Yes.
Okay. Another side? Yes.
Yes.
Okay. Good. Now we're going to go ahead and move on to your neck.
Okay.
So I'm just going to look at it. It is midline. Your trachea is midline. I do not see any pulsations or abnormalities in the skin or in the carotid arteries at this point. So I'm just going to touch. Nice and pink. Good. Any pain with any of that? Good. All right. Now I'm just going to feel for your thyroid. Okay. Go ahead and swallow for me. Good. And I'll turn that. Yes. Good. And swallow. Perfect. Good job. Good job. Any pain with that?
No.
Okay. All right. Now I'm going to do range of motion of your neck. So chin to chest, all the way up to the ceiling. Good. Now look to your right and left. Great. And then ear to shoulder. Perfect. Any pain with any of that?
No.
Great. Okay. Now at this time I'm going to look at your back. Okay. I'm just going to undo this if that's okay.
Yeah, that's fine.
Just going to inspect your skin and watch for work of breathing. No trouble breathing, no bruising, no pulsations, no abnormalities. Her skin is nice and even and warm to the touch. I'm going to touch here. Go ahead and take a big deep breath in and out for me. Good. Perfect. And there's good symmetrical rise. Now, I'm going to just do tactile firmness. If you'll say 99 every time I touch your back.
99.
And you're just feeling for vibrations.
99.
Any dullness or changes.
99.
Good.
99.
Good. Go ahead and cross your arms across your back. Thank you for me. Thank you. And I'm going to percuss. You're going to feel me tap.
Okay.
And you're just going to listen for any changes in dullness or anything like that to make sure there's not any masses or lesions. I'm gonna listen to you now, okay?
Okay.
If you'll take a big deep breath in every time you feel my stethoscope, okay? Go ahead. Good. Perfect. Good long deep breaths. You're a hyperventilator. You're doing great. If you need to rest, just let me know. Arms up above your head for me. Take a big deep breath in. I'm going to get this right lobe over here. Okay. Good. All right, put your arms down. Now, I'm going to do egophony, bronchophony, and the whispered ventriloquy. So I'm going to put my stethoscope on you, and then we're going to say 99. Okay, so this is bronchophony. Go ahead and say 99.
99. 99. 99. 99. 99. 99.
Cross those arms for me. Thank you.
99.
Perfect.
99. 99.
Okay, now E for egophony.
E. 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 E.
You're doing great. Thank you.
E. 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 E.
One more.
E.
Okay. Now I want you to whisper cheese, okay? Keep those arms crossed for me.
Cheese. 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 Cheese.
Are you hungry yet?
Cheese, yes. Cheese.
Perfect. Now while I'm here, I'm gonna just check your costovertebral vertebral angle, costovertebral for any tenderness. Okay, so just let me know if this hurts at all.
No. No.
None of that.
Mm-mm.
Okay. All right, go ahead and cover you back up. And let you turn around, and we're gonna do the same to the front. Okay.
Okay.
Go ahead. Going to look for work of breathing. I would expose her if we were not making a video, and look for any pulsations, abnormalities in the skin, okay? Now, I'm just going to put my hands right here. Go ahead and take a big deep breath in and blow out. Good. And then 99.
99. 99. 99. 99. 99.
Good. And then I'm just going to... Well, sorry.
No, you're fine.
Alright, and then I'm just going to listen, okay?
Okay.
Big deep breath. Good. And out. Alright, so now I'm going to move on to the cardiovascular part of this assessment. We'll do it kind of two parts. We'll do some sitting up and then we'll lie down, okay?
Okay.
So the first thing that I'm going to do is just look here and palpate your carotid arteries. Good. No pain with that. I don't feel any thrills. And then what I'm going to do also is just listen to you, okay?
Okay.
And there's 5 different points. I'm just listen to you with my diaphragm and my bell. The aortic pulmonic valve, aortic, pulmonic. Down here on Erb's point, tricuspid valve, and then mitral or the point of maximum index. And I'm going to do the same with my bell. We'll go ahead and lie down. Okay. And then while we lie down, just gonna do an exam again, lying down, especially of your turn your head slightly that way for me. Good. And then this way. Perfect. And I'm just gonna listen real quick for any bruises.
Okay.
Hold your breath. Breathe. And hold your breath again. And breathe. Alright, now I'm just going to listen to those same places again, okay?
Okay.
I'm just going to feel for any thrills in those areas. And of course this would be better done without clothes on so that you can feel it. Now I'm just going to feel for any heaves or lifts, okay? I'm just going to feel any touching. There. Good. Now I want you to turn over on this side and find your point of maximum index. Go ahead and put your arm to your side. There you go. And I'm just going to count down to the 5th intercostal space. And go midclavicular 1. Just going to listen right here for a full minute for your apical heart rate, okay?
Okay.
Alright. It's 81 with a regular rate and rhythm. Go ahead and lay flat on your back for me. And I'm going to move on and let's just expose your abdomen, okay?
Okay.
So I'm just looking at her abdomen for contour and symmetry. I don't see any pulsations or peristalsis. And her skin is nice and warm to the touch. Have you been having any belly pain or anything?
No.
I'm going to go ahead and auscultate first, okay?
Okay.
While I do this, I'm going to do all 4 quadrants as well as your aorta, renal arteries, iliac, and femoral. And then when you listen to all 4 quadrants, of course, you have to wait for a full 5 minutes to be adequate. I think you're ready for lunch.
Yeah.
Me too. Good. Normal active bowel sounds. Now I'm just going to tap a little bit, okay?
Okay.
And I'm just listening for dullness, tympany, anything that could show any mass or lesions. And then I'm gonna touch lightly, okay? Just let me know, does that hurt at all? Good. Any there? Good. Now I'm gonna do it a little more so that I can feel your spleen and for any masses or anything,
Okay.
as well as your liver, okay? Does that hurt at all? There's your liver. And then just deep, I know it's deep, but does that hurt at all? Okay, good. So, did that. Now, no splenomegaly or hepatomegaly, no tenderness, and normal active bowel sounds, okay? So now what we're going to do is we're going to stand up and we're going to do range of motion, okay?
Okay.
Go ahead and let me help you so you don't get... Let's straighten this up real quick. Alright, go ahead and have a seat, and we'll do upward extremities first.
Okay.
So first I'm going to do cerebellum function, okay? So what I'm going to get you to do is flip-flop your hand back and forth as fast as you can. Good. Another. Good. Alright, now fingers. Good. And then put your finger on your nose to my finger as fast as you can, back and forth. Good. Perfect. Then we're going to do graphesthesia and paresthesia. Steresthesia. Go ahead and hold out both of your hands. Close your eyes for me. And so steresthesia, we want to touch that and tell me what that is.
Paperclip.
Good. And this?
Quarter.
Great. All right. Now I'm going to draw something in your hand and you tell me what it is. Okay, and this is for graphesthesia.
A heart.
Good.
Smiley face.
Perfect. All right. Now, go ahead and let me see your hands. Good. Good. Now I'm just going to feel all of your joints. Any painness, redness, or anything? All right. Any none of that. Go ahead and rotate. Good. And then I'm going to just feel for your pulses. Perfect. Can you squeeze my fingers real tight? Perfect. Now what we're going to do is we're going to do range of motion, flex, extension, and all that with all of these abduction and abduction. So we're going to squeeze and out and big and like this. And then thumbs. Perfect. Now ride like a bicycle. Good. And invert and evert. Great. Any pain with any of that? Okay. Now hold your hands up for me like this. Now push and pull. Great. And that's 5 out of 5 strength. Any pain here? Great. I'm going to check these pulses. Perfect. All right. And we're going to flex and we're going to extend. Perfect. And then any pain in these joints. All right. We're going to abduct and abduct and flex or extend, hyperextend, invert rotation. Yeah, external rotation. Perfect. And then circumferential. Perfect. All right. Go ahead and close your eyes. Any pain with any of that? All right. Let me see your hands. Stretch your arms out for me. Let me know when you feel this, okay?
Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Perfect.
It's soft.
It's soft? Good. And we checked shoulder strength with cranial nerve 11.
Okay.
All right, now I'm going to go ahead and come down here to your toesies. I'm going to take these socks off for just a second so I can see your toes. Let me check. I can't really check your cap refill, but you normally would on your fingers and your toes here, and you just squeeze. Now, let me see those. I'm going to touch on your joints. Is any pain, swelling, any of that going on? Okay. Now, can you flex them for me and extend just your toes, baby? Yep, toes and back. And then abduct, wide, and close together. Good. While I'm down here, I'm going to do the Babinski reflex. Go ahead and relax, and I'm going to touch, and you should see her toes will go under, and then here, yes, perfect. Checking your dorsal pedal pulses, tibial pulses, and then your Achilles reflex. You're going to feel me touch, okay? All right, and then this one. Good. And then with your knees, any pain or tenderness there?
No.
Good. And then extend them and flex them. Perfect. And then just your patellar reflex here. Good. And here. Good. And then let me know if you can feel this, okay? Close your eyes and tell me when.
Now. 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 Now.
Okay.
It's soft too.
Soft. Push against me and pull back. Good. And pull up and push down. Awesome. And then pull against me towards, yeah, that's your hips and out. Good. 5 out of 5 for hips. And let me check your reflexes up here. So this is your radial brachial reflex, and you'll be looking here for that thumb. Good. And here. Good. You see it go?
Yeah, it's weird.
And then flex for me. Good. And relax. So I've got it on there. And just relax that arm. Feels funny, huh? Good. And then tricep. That was your bicep. And then your tricep. Just a smidge. You're doing great. And just relax it. There it went. Good. All right. Now we're going to stand up. And while you're standing up, I need you to flex your foot and your other knee. Good. Now your hips, we're going to do abduction and adduction. Good. And then we're going to round and round. Perfect. And the other. Good. Any pain or tenderness with that? And then do your hips hurt at all?
No.
Good. Good, good, good. And then I want you to extend your hips. Perfect. I'm going to look at your back and do your spine. So go ahead and flex forward. Good. Any pain with that?
No.
Your spine is nice and straight. Good. No curvature. Stand up for me. And then we're going to do lateral and the other side. And then hyperextend backwards. Yes, perfect. And forwards. Good. And then we're going to rotate all the way around. We're gonna do the Rumberg sign, and I'm gonna get you to close your eyes, put your feet together. I'm not gonna let you fall. We're just checking if you sway, which you don't. Good. Now we're going to walk across. You'll come over here. I want you to walk across the room normally, and when you come back, heel to toe. Perfect. Any problems with any of that?
Mm-hmm.
Good. Now, can you jump on one foot for me? Good. And the other one? Good. All right. That completes our exam today. Thank you very much for your time.
Thank you.
Mhm.